What has been achieved since this new CEO has come on board at the hospital and the school?
Well, that is somewhat of a difficult question. I think a lot of hope was put in a new administrative leader to have a grand vision for this institution, to make it the regional leader in the Southwest, and to also make it a leader, west of the Mississippi. We have major departments there, obviously San Francisco, Los Angeles, there are a few others. But in the end, obviously, the University of Arizona, the medical center, could be right there where Baylor, where UCSF, UCLA, and so forth are. Unfortunately, we have not come to that point yet. We are at a stage where within the next couple of years, we probably would be able to close the gap to these other institutions. But it has not been one of the vision of the new CEO has not really been aligned with creating a national College of Medicine and national health network. So this is my concern. We also have not seen a major change in patient satisfaction. I remember patient satisfaction was in the 70s a year or 2 years ago. It remains in the 70s now. Dr. Robert Poston had a 90% patient satisfaction rating, and unfortunately he was forced out. So a number of wrong decisions have been made under the current leadership, and I hope they eventually can be rectified.
You know, years ago I came up with a comment that my father gave me, and I think you'd agree, Doctor, that when someone takes the responsibility, they automatically have the accountability. Would you agree that those at the center of this problem, the situation, as it relates to you and other doctors, they've taken that responsibility, they have that accountability to someone, do they not?
Absolutely. You know, the responsibility, of course, lies in the leadership. The accountability lies with the boards. In this case, the board of the healthcare network, and on the university side, the board of regents. They have to make sure that whoever is responsible and whoever directs the university or the health network at a specific time and point, that all of this is done in the best interest of the public, the citizens that we serve. So that goes back to the boards, and the boards then have to take action if they find that the people responsible for leading and directing have made mistakes, and then obviously changes need to be made.
Go. Reiner, I have a question to ask you, and this is actually a series of questions. Who is this CEO?
Well, the new CEO of the UHN network is Dr. Michael Waldron. He joined us in February of last year, slightly over 1 year ago. Came from the University of Alabama, Birmingham, where he was the hospital CEO. And I think what attracted him to Arizona was the fact that he would not only be CEO of a hospital, but of a network that encompasses 2 hospitals, 1 health plan, and the physician's plan. It's a $1.2 billion business in terms of revenue, as big as the university. And I think this is what attracted him. I don't think that he at the time understood about the complexities and the issues that are going on. He did align himself, unfortunately, very early on with the former dean. And I think that in many ways has not allowed the institution and also him to prosper. I think if you come in a place like this one, you have to make a fair assessment of what is going on. You have to listen to both sides. I think it's very fair to say that only one side was heard, and that is the side that has not been necessarily to the advantage of the patients, the citizens here in Arizona, and to the faculty. I think over time this will become very apparent. I think the financial situation is looking ever more dire, and I'm sure that at some point the board and other people in responsible positions within the government and so forth we'll take a closer look at what is going on. I think in many ways the rights of the faculty have been stomped on, and the vision for a nationally outstanding medical center and College of Medicine has almost disappeared.
You referenced this gentleman, this CEO. Tell us about his qualifications. Why did he get this position? I mean, he was at another place. He came here. What are his qualifications medically? And as well as abilities in terms of leading a large organization?
Well, at the time I was not part of the search process. I was part of the search process for the vice president, and I think the university ended up with an excellent vice president. The search for the CEO of the health network was something that was kept overall relatively non-transparent, I think would be the right word. In the end, there were two candidates that were interviewed. One of them was Dr. Waldron, who also holds an MBA degree, and who clearly on paper is qualified for such a position. Again, I think many of the faculty, and probably half of the faculty that are in my support, would have liked to see him take a different approach and come up with a different analysis of what the task of this institution is, what the deficits are, where we have to improve on. And we still don't have a 3, 5, 10-year plan. We hardly make it to a 1-year plan. We have not improved in some of the core issues that he had touted as very important to him. Patient satisfaction, I mentioned before, we are still around 70-75%. And then you have a leader like Robert Poston or others with a patient satisfaction score of 90%, and they're forced out for personal issues. I think a CEO's obligation is to look subjectively, not subjectively, but objectively at what is going on, to analyze things, and then to make the right decisions. And I think we're still waiting, in many ways, for the right decisions.
Here's an interesting question for you. Where are UAHN, UAMC, and UPH today?
Well, let me maybe answer that in a more global way. I'm very proud, and I was and continue to be very proud being associated with the University of Arizona. I think it is a great institution. It has served the population very well. We have some outstanding colleges, College of Science, for example. We have great programs, be it in astrophysics, planetary science, optical science, internationally, worldwide known. We have one huge deficit, that is the College of Medicine. And everyone has known that, for many, many, many years. It's a daunting task for any kind of a president, because the two things that can explode in your face is, first of all, the Department of Athletics. If it's not successful, and thanks God we are very successful in that regard, and the College of Medicine, because that is, by numbers and by revenue and by everything else in the association with the hospitals, the largest financial enterprise within the university system. I think when the new president came, she had plenty of work to reorganize certain structures within the institution. I hope that at some point the College of Medicine will get her almost undevoted attention, because I think without clear leadership, this college is not going where it should go. There's no reason why the University of Arizona College of Medicine should not be where, for example, the College of Medicine in Minnesota, in Michigan, in Ohio are. We are a great university. We have to concentrate on what our capabilities are, on the talents that we have here, and we have to make it an institution that the citizens are proud of. With regard to UHN, UPH, UAMC, this is a little bit different. I think they have been organizations that have been not as successful as the university, neither financially nor in terms of clinical or professional attraction. I think leadership and changes in leadership are important to make this place a place that, for example, the Cleveland Clinic or the Mayo Clinic were 30, 40, 50, 60 years ago. I know some people may laugh at that, but who would have ever expected that Rochester, Minnesota would become the world's hub when it comes to excellent clinical medicine? Who would have ever thought that a little place in Cleveland would become such an excellent center? We have so many resources, so many beautiful attributes in the state that this could be the place to go for many Americans to come here and get first-class clinical care. But it needs a vision, it needs leaders, it needs an understanding of who we are, what we are, and where we want to go.
Well, this has been Craig Paulson. I've been in a very important conversation with Dr. Rainer Gruessner. Sir, you've been very open, you've been very honest, you've shared your heart. I want to thank you for your time today. We appreciate it. Thank you so much, sir.
And I thank you for this interview and giving me a chance to tell the side of the story that only very few people know about, and I think it's important that the public knows what is going on. Thank you.